breast implants. They're everywhere in pop culture, fashion, and cosmetic surgery, but the history behind them is far more complicated than most people realize. In the early 1960s, plastic surgeons Frank Gerow and Thomas Cronin set out to develop the first silicone breast implant. According to historical accounts, the idea first came to Dr. Gerow inside a hospital blood bank. When he picked up a bag filled with blood, he noticed how it felt, soft and pliable, much like human tissue, and remarked, "It feels like a woman's breast." That moment inspired what would become the first silicone implant. But before ever trying it on humans, they tested it on a dog named Esmeralda. After several weeks of observation, the implant appeared safe enough for human use. In 1962, the first human recipient, Timmy Jean Lindsay, underwent the procedure, not initially for cosmetic reasons, but for medical ones. She would become the first woman in history to receive a silicone breast implant. Breast implants quickly grew in popularity. By the late 1970s, thousands of women were undergoing augmentation surgeries each year. But as more women received implants, reports of complications began to surface. Some women experienced ruptures, chronic pain, and autoimmune disorders. These complications sparked debates in the medical community and eventually caught the attention of federal regulators. The first major legal cases emerged in the early 1990s. Women began filing lawsuits against manufacturers, alleging that silicone implants caused serious health problems. Cronin, one of the largest manufacturers, faced thousands of lawsuits. In 1991, a federal jury awarded $7.3 million to a woman whose implant ruptured and caused permanent immune system issues. These cases raised public awareness about potential risks of silicone implants. In 1998, Cronin agreed to a massive $3.2 billion settlement to compensate nearly 176,000 women. Some of these settlements included confidentiality agreements, meaning women were legally restricted from speaking publicly about their experiences. The FDA called for a moratorium on silicone breast implants after mounting reports of ruptures and autoimmune-like symptoms in 1992. Silicone implants were banned for cosmetic use, but still permitted for breast cancer reconstruction and limited clinical trials, meaning some women continued to receive them even during the ban. Former FDA Commissioner Dr. David Kessler said manufacturers hadn't proven long-term safety, leading to more than a decade of restricted use. It wasn't until 2006 that silicone implants returned to the market under strict post-approval monitoring. The story didn't stop in the US. In the 2000s, French company Poly Implant Prothèses, or PIP, caused an international scandal. PIP used industrial-grade silicone meant for mattresses in their implants, exposing thousands of women to potential health risks. In 2021, a French court ordered the German certification agency, TÜV Rheinland, to pay victims up to €37,000 per person. The scandal highlighted the ongoing importance of regulation, safety testing, and transparency in the cosmetic surgery industry. In 2021, the FDA added a black box warning to all breast implants, the agency's strongest caution. It reminds patients that implants aren't lifetime devices. Complications can increase over time, and some cases have been linked to a rare cancer called bioalcohol and systemic symptoms known as breast implant illness. Yet many women report they were never shown the FDA-mandated checklist before surgery, raising real concerns about informed consent. The FDA also lists symptoms reported by patients, including fatigue, brain fog, joint and muscle pain, hair loss, weight changes, anxiety, and depression. Silicone gel implants were only reapproved in 2006, after the agency required long-term safety studies. Those follow-up studies now provide evidence supporting what many women have said for years, that breast implant illness is real. In the UK, regulators have gone further. The MHRA officially recognizes these symptoms and is collecting data to reassess implant safety, while the US still stops short of calling BIIA defined medical condition. The history of breast implants is a story of innovation, but also of controversy, lawsuits, and lessons learned. Understanding it empowers us to make informed choices about our bodies and our health. The story of breast implants isn't just about beauty. It's about science, safety, and the women whose experiences shaped the industry.